Thank you so much, Carol, for inviting me to be a guest speaker today, and it's lovely to meet with you all this morning. My apologies for not being able to be there in person. My name's Carrie, and as per Carol's introduction, I'm a psychotherapeutic Gestalt therapist. In lay terms, Gestalt therapy was developed in the 1940s by Fritz Perls, a well-renowned Gestalt psychotherapist, psychoanalyst, and psychiatrist. Gestalt therapy sees the importance of viewing a person as a whole. This means understanding a person in the context of their current environment and their relationship with it. As Gestalt psychotherapists, we focus on the present moment rather than past experiences, although these do play a vital role in the healing process. For example, I might note the way someone shifts in their chair when a traumatic experience is mentioned. I'll look at what feeling that evokes, where the client is feeling it in their body, and try and work out the best way to help them manage and work through them. In short, once we understand the triggers for how we're feeling, we can understand how to manage these going forward. It's a very humanistic and gentle approach. I'm a registered member of the British Association of Counsellors and Psychotherapists, Counselling Directory, Complementary Medical Association, but most importantly, I'm a fellow ostomate. I'm going to be talking to you today about counselling matters from both a psychological and practical perspective. I myself have a long history of colorectal surgeries, which I'll expand on during my talk. I chose my career as a therapist and ultimately specialising in this field because I wanted to be able to offer clients that which I wasn't able to receive when I was struggling and at my worst. So let me give you a little insight into my story. At 24 years old, I desperately needed therapy, both pre and post ostomy surgery, for severe ulcerative colitis. But no one suggested it to me or even asked how was I feeling, how was I coping. Those two simple questions have such hidden depth and meaning and might have made all the difference to me. I hear often from different people about 3-year waiting lists for counselling on the NHS, and to me, it's just unacceptable and unfair. People need the time to process their feelings before they even have ostomy surgery, in readiness to be able to cope. Every one of us should have this option, when and if we need it. At my initial surgery, I had my whole large bowel removed, a temporary stoma for a year, an internal J pouch, and a fistula. This was the start of an extremely long journey. Since 1995, I've had a total of 17 surgeries, a mixture of bowel and abdominal related, and since February of last year, I've had a stoma, my fourth in fact. Over the years, I've had multiple visits to A&E for blockages caused by adhesions. I struggled with excruciating pain. I almost died twice and often felt like I was never going to feel normal again. All the physical problems I experienced were extremely hard, but it was just as hard, if not harder, dealing with the emotional aspects. And through most of that time, there was no one to help me therapeutically that really understood, that really got it. The fact I'm here today is a miracle. I was told last year, prior to my final surgery, that there were 3 potential outcomes. 1, I wake up and I have stoma number 4, very little intestine left, but I'd be able to eat, albeit the ratio of food to output would be extremely fast and high. 2, I wake up with stoma number 4 and would be on TPN, total parenteral nutrition, meaning I'd never eat again and I'd be peg-fed due to my not having enough intestines to function normally. Or 3, I don't wake up. I had a 10.5-hour surgery where 120 adhesions were removed. Today I have my stoma, I eat normally, and as you can see, I'm here talking to you. As well as my amazing surgeon and his team at both Northwick Park and Central Middlesex hospitals, the stoma nurses and my loving family, ultimately I had an inner strength inside of me that regularly seemed to whisper in my ear, "You've got this, Carrie. stronger than you know. Having passed surgeries to take down my stomas and go back to living a bag-free life came with both positives and negatives. With an internal pouch, there was the obvious, which was no more stoma, no more bag changes, no more burning, no more bag. But there was also the potential return of urgency, occasional bouts of pouchitis, and having to plan day trips around where the toilets would be. I had reversal surgery 3 times, and each time was challenging, but it made me stronger and more resilient. It's about how we look at the adversities we face in our lives and who can help us to manage through these. I'm not sharing my story to shock you, and to be honest, my situation isn't necessarily the norm, but it's to let you know that we all have an unbelievable resilience to want to push through the most challenging times in our lives. Some may take longer than others, but it's that resilience that gives us the strength to keep going. You're here today because you had or have been told you need an internal pouch and stoma, or are considering reversal surgery and are trying to come to terms with it and what it will mean for your future. Whether we have a stoma on the outside of our body or an internal pouch, there are so many worries associated with these. I know only too well these have significant practical effects on all aspects of our life, such as diet, underwear and clothes we wear, certain lifestyle activities, making sure we have a change of clothes with us, just in case, and constantly having to remember to take out our trusty appliances and products with us whenever we leave home. From a physical perspective, with a stoma there's the worry of leaking, burning the area around, being caught short in public, pain, fatigue. We learn to live a new normal. Aside from these potential fears, having a stoma can also have a severe effect on mental health. Anxiety, denial, a feeling of hopelessness, depression, suicidal ideation, body image issues, and low self-esteem are just a few of the common disorders that ostomates suffer from. When we're given a diagnosis and advised that we need to have a stoma, an internal pouch, and sometimes a fistula, there are so many uncertainties and fears about how this life-altering event is going to completely change our day-to-day existence and how we'll cope. Some people feel like their whole world is about to fall apart. How do you manage this devastating news? Your surgeon will tell you, practically, what the procedure entails as much as they can and be as kind and sympathetic as they can. And you'll then likely not see them again until the day of surgery. You'll then see a stoma nurse who'll go through all the different types of products, how to use them, how to manage the bag, and even check on how you are. They'll be extremely kind and sympathetic. However, following various conversations and meetings with surgeons and stoma nurses, they have a heavy caseload of patients and just can't spend enough time with each one as much as they might want to. So you have all this information swimming around in your head and feel so overwhelmed. What happens after that? Who do you talk to about all these emotions and worries? If you have close family and friends, that's really great. They'll give you a certain amount of support. But how do you manage and understand these internal feelings going forward? Well, that would be with someone like myself, a therapist. But in this case, a therapist that doesn't only have experience of working with individuals who are considering, are about to, or are post-ostomy surgery, but who also is one. Someone who has real life-learned experience as you do. Someone that understands what your reality is, what you're going through, and can genuinely empathize. I absolutely can say that I get it. Therapy can be life-changing, but from a positive perspective. To be honest, a good therapist is able to work with anyone sitting in front of them. Talking to someone who also has an ostomy brings a completely different connection into the room. It's an unsaid knowing. As ostomates, there are times when we really have to push ourselves to keep going, and often the support of those close to us can be priceless. However, it's also important to remember that our loved ones, be it a partner, children, parents or friends, might be struggling too. They feel they need to remain strong for us, but actually, I hear often that there's a feeling of helplessness and fear. They may also need a space to be able to talk about how they're feeling and how they're coping. My journey, as you've heard, has been an interesting one to say the least. I know what I went through psychologically and physically, so my guess is you may be struggling with something similar. Every now and again, we all need a helping hand to manage our responses to life situations. Life is 10% what happens to you and 90% how you respond. And while we can't control all the circumstances that come our way, we do have the power to control the way we react to them. Whether it's responses to diagnosis regarding pre- or post-op surgery, or just needing a listening ear to work through difficult thoughts or feelings. For those who have never had therapy previously, the work is, as I mentioned at the start of my talk, from a humanistic approach. I'm empathic, warm and non-judgmental, and my role is to keep you grounded and safe enough for us to be able to talk about and work through all your issues together. My role is also to hear, see and metaphorically hold you through whatever it is you're struggling with. I previously mentioned the worries and fears of how you cope initially with the news that you'll need to undergo surgery to have a stoma and internal pouch. Practically, if you don't have a partner, how will you tell someone new? Will you find a new partner who accepts the new you? If you do have a partner, what might they be thinking? How might this affect a physical relationship? What might their reaction be? There's a fear they may be turned off or not want to be intimate, although this isn't necessarily always the case with everyone. With an internal pouch, you might worry how someone might react to your needing to use the toilet urgently or even regularly. What will they think of my scars? Will they accept me for me? Other fears with a stoma might be, what happens if my bag leaks in public? How will I manage changing the bag? Will anyone realise I have a bag? There are so many thoughts that go round and round in our heads. These thoughts can cause us to feel less of a person, and sometimes severe mental anguish, which can then lead sometimes to self-sabotage, body image issues, low self-esteem, shame, and suicidal ideation. There's also a deep feeling of loneliness. Sometimes we feel as if we're the only person in the world about to go through or have been through this type of surgery. There's also a form of vulnerability and loss of control we might feel knowing there's no other choice and it's out of our hands. I'll often tell clients that it's okay not to be okay, but if we don't reach out and let loved ones know we're struggling, they may presume we're okay, and sometimes we aren't. It's okay to show our vulnerable side. It's not a weakness. In fact, it takes a lot of courage. Someone told me recently, the two most important days in our life are the day we're born and the day we find out why. This really resonated with me because it took me a very, very long time to find meaning to all I'd been through. And I think I finally realised that I believe I'm here to help other ostomates who are struggling to come to terms with both the idea of surgery and those who already had it, because I never had that option. I now have Mimi, my stoma, and we have a pretty good relationship for the most part. But for a long time, I felt that having a stoma took over my whole being. But having had therapy myself, I know now that she's just a small part of me, not the whole of me, and that was really healing to be able to finally accept and acknowledge that. I was able to come to terms with her on a different level. There's another important thing I'd like to mention. Some ostomates choose to name their stoma buddies. I've heard names such as Betty Poop, Paloma Stoma, Homer the Stoma, Pepe Le Pew, just a few that people have chosen for them. It can often help to break down some of the barriers that exist around talking about poo and bodily functions. And it can also make it easier for family and friends to talk to you and vice versa about what you've been through, your needs and the challenges you face managing your stoma. Not everyone chooses or feels able to do this, and that's okay too. Some ostomates have told me they hate the word stoma because for them it has nothing but negative connotations. Some ostomates find the word bag dirty, unsexy and unclean. And others have said they gave their stoma a name to take the edge off it, just to call it something other than the bag. It seems to me that naming is part of a psychological coping mechanism, and my take on this is whatever gets you through it. So whether you've had or are contemplating ostomy surgery and you feel you're struggling, you don't need to manage alone. If you'd like to talk to someone who really understands what you're going through, you can contact me through the Ileostomy Association. Thank you again, Carol, and the other guest speakers so much for listening, and to those of you that have attended today. I just want to leave you with one thing. At the start of my talk, I told you about my 3 possible outcomes during my final surgery, and that I regularly told myself, you've got this, you're stronger than you know. If you remember one thing from this talk, please remember, you've got this and you're stronger than you know. Thank you so much.